With violence against healthcare workers on the rise, Oregon nurses are now sharing their own experiences.
And the Fox 12 investigators took a closer look at the issue of workplace violence in Oregon hospitals, why it happens, and what healthcare workers say still needs to be done to prevent it. Fox 12's Simon Gutierrez is here with the story now.
Yeah, Wayne, thanks. According to the Oregon Nurses Association, a staggering number of assaults on healthcare workers, nurses in particular, go unreported. They say that's why the reports we do hear about, the numbers we do know, are so concerning. In hospitals around Oregon, assaults on hospital staff for years have largely been seen as part of the landscape, almost inevitable.
Having things thrown at me. I've had IVs who, they've ripped it out, it's bloody, they've thrown it at me. I've had the table in the room, shoved at me, water bottles thrown at me.
Virginia Smith is a charge nurse at Providence Willamette Falls.
We've seen an increase in aggressive behaviors across the board.
Unfortunately, it's become something that in many hospitals and facilities is just part of the job.
Should it be?
No, it shouldn't be.
Also a registered nurse, Travis Nelson says he was often called on to respond to difficult patients, in part because of his size.
You've been punched?
Oh, yeah. I've been punched.
According to the U.S. Bureau of Labor Statistics, the rate of intentional injuries to healthcare and social assistance workers has been steadily climbing over the last several years. In 2018, the healthcare industry had the most reported injuries in the country, 544,000, significantly more than manufacturing and construction.
What does that do to you when you're taking this home with you? You realize this is what you're going to work to the next day. What effect does that have on you?
It's hard. It's stressful knowing that you have to go back the next day and possibly even care for that same patient. It can be hard.
In the 2018 legislative session, lawmakers passed Senate Bill 823, the Oregon Healthcare Worker Protection Act. It requires hospitals to do comprehensive security and safety evaluations and develop an assault prevention and protection program. Nelson says it's a step in the right direction, but also says chronic understaffing at hospitals needs to be addressed.
When nurses have more patients, are in rooms alone more often, that leads to them potentially being harmed.
We asked Portland's biggest hospitals, OHSU, Legacy, and Providence, for recent numbers detailing assaults on staff, but they couldn't provide them. Providence referred us to the Oregon Association of Hospitals and Health Systems. That organization recently released a study on the cost burdens imposed by state regulations, which found that Oregon hospitals spent $126 million a year on labor to comply with those regulations. It also said, quote, hospitals surveyed felt strongly that Oregon's laws on nurse staffing diverted their time and resources away from patient care without adding value to patient and employee safety. Nelson says pushback from cost-conscious hospitals is to be expected, but says it shouldn't keep them from wanting to protect their employees.
I think in a lot of hospitals and healthcare facilities, there's just an expectation that that employees will occasionally be assaulted, and that's not okay.
Experiencing that violence at work is not something that we should expect to go into every day. We should expect to be able to come into work and feel safe.
Now, that new law that passed last legislative session will also require hospitals to keep track of how often workers are assaulted and keep at least a 5-year record of that. It also requires hospitals to train employees in how to prevent assaults and protect themselves from injury. Reporting live in studio, Simon Gutierrez, Fox 12 Oregon.